welcome everyone to the People's House.
Mr. Speaker, will you please call the House to order?
The bill is passed.
This bill says that New York understands the breadth and the depth of the problem.
Hi, I'm Tom Abinanti. Welcome to Assembly Update. I'm here today having a conversation with two women visiting us at Albany today, Karen Bernbach and Lillian Jones, both here on behalf of a very good cause, the American Cancer Society. Karen, who are you? Why are you here?
Well, I'm a over 20-year volunteer for the American Cancer Society, and I'm here because I believe our mission is very, very important, and I believe that government is necessary to get to the completion of that mission.
Now, you're a Westchester resident, right?
I am a Westchester resident.
Where do you live?
I live in New Rochelle. I've lived there for 40-some-odd years, and I've been involved in this because it's important to me and it's important to everybody else.
Cancer Society depends on a lot of volunteers, doesn't it?
It's a very, very big grassroots organization, as is the American Cancer Society Cancer Action Network, which is our lobbying affiliate, which is a grassroots organization also. I'm also involved with that. I'm what they call a team leader for the American Cancer Society Cancer Action Network, and I cover anything that's within the 16th Congressional District.
So many people think of the American Cancer Society as this big organization out there, and what they don't recognize is that a large part of it is made up of people like you who care and who spend their time being the community outreach for the Cancer Society.
Well, it's a big part of the job, is letting people know what the American Cancer Society does. It's one of the reasons that I'm with the American Cancer Society as opposed to other excellent cancer organizations, because the American Cancer Society takes care of all aspects. It takes care of the research, which everybody is mainly concerned with, but the education is there, the patient services are there. That's why the American Cancer Society is in my heart.
And an old friend from a long, long time ago, I don't want to let on our age, but we've worked together for a long, long time, is Lillian Jones.
Well, thank you, and so appreciate being here today and to be able to renew our discussions about tobacco control and cancer service programs. As your constituents might not know, Tom, Assemblyman
Assemblyman Tom, right?
Assemblyman Tom has been a long advocate for tobacco control in Westchester County, and has been very involved in a lot of the programs that we've been in the forefront over the years, including the securitization of the tobacco funds, including making sure that display cases for tobacco products are put out of the way of kids. You worked on the flavored tobacco issues, and of course the biggie was getting smoke-free Westchester County, one of the first counties in the state to really go smoke-free totally.
Right,
for
in workplaces and indoor. We go back a ways. You're a former county legislator from Putnam County, aren't you?
I am.
You're living proof that there is life after politics.
And yes, absolutely. And it's quite
we worked together. When I was a county legislator, I set up a task force, a clean air task force.
That's right.
And you were on that. And as a result of your efforts, we have a very nice 25-page report. And on the basis of that report, we passed several pieces of important legislation in Westchester County that are making Westchester's air a little bit cleaner and helping with some of the problems. I mean, we have a big asthma problem with kids, and especially in the inner cities. We have a problem with, I guess the way I described it best was pollution that emanated locally. Didn't get blown in from the Midwest. It was local, it went up, and it came right back down on us. Right. And we came up with some legislation way back then, which has been in effect and working in Westchester County to try to cut back on the locally produced air pollution.
Right, and one of the committees that you probably don't remember, we did start a committee in Westchester County on access to health care. Right. Where you were kind enough to provide some staff from your legislative offices to help us with that. And we, actually that committee is still functioning in Westchester County, and they meet monthly and have information. They're updating all the a lot of the service providers on the information on access to health care and the changing health care market.
But now
so
you have a
it's
new
been
role.
very productive.
What are you doing now?
Oh, you had to ask that, right? Right now, you know, the American Cancer Society has gone through quite a transformation, and we're trying to be much better stewards of our dollars and the fundraising that has been done on behalf of the American Cancer Society. My new role is that I oversee the activity basically in Westchester, Rockland, and Long Island. Long title, it's Senior Director of Community Engagement for Greater New York.
You're basically the face of the American Cancer Society in Westchester, Long Island, and Rockland County?
Yes, that's
They could
it.
not have chosen a better person.
Well, thank you. I so
Yes,
appreciate that.
So you're here in Albany, in this foreign land, as people often look at it, and you have several items that you're trying to bring to get some focus on in Albany.
Yes.
What are the issues that bring both of you here?
Well, the first one that I would like to talk about is tobacco control funding. 1 in 4 deaths are caused by tobacco, which is a disgrace. There is really no need for that. And since 2007, tobacco funding in the state of New York has been cut in half.
Not tobacco funding, tobacco
control funding. Yes,
funding.
yes, right. Tobacco control.
Now we use
program.
those monies to advertise to people
Right.
what the horrors of
Right,
smoking
that's where
tobaccos.
it has been mainly in the media campaigns that have been cut. But the state takes in $2 billion in tobacco revenue and only spends 2 cents on the dollar. And there's, you know, the CDC recommends 16% more than the state spends. We don't do that either. So what we're talking about is that this is
money
not
coming in from the tobacco companies.
Well, right now-
because they were found guilty of certain things way back
Right,
when.
that's where
actually, that's part of the money, but the
And the rest of the money's tobacco.
No, that's actually in addition to the $2 billion that Karen is talking about.
Tobacco
In
The $2
addition
billion,
to.
the $2 billion is from tobacco tax revenue, I believe.
And tobacco tax revenue has shown that it's proportionate. When the taxes go up, smoking goes down. And that in and of itself should be enough to show that how important these raises in taxes are. But the idea is that we can't keep cutting. It's not cost effective, really, when you think about it. That's what everything comes down to, cost effective, dollars and cents. Well, when you have to pay for the health care for people from these tobacco-related diseases, that's not cost effective, and it's truly not cost effective in lives. So what we're here asking for is to bring the tobacco control funding to $85 million.
It was $85 million at one time.
Right, back. I'm sorry, I should have said back to $85 million. And is that optimum? No, but we're trying to be realistic, and that's why that's what we're asking for. And that's why we're
over
here.
the last few years, while we have been controlling state expenditures, we've actually cut some of the good things that we were spending money on.
Well, that's it.
And one of them is what we call tobacco control, but a lot of it is again, information and education, trying to ensure that kids don't take up smoking,
Right.
and to try to dissuade those who are smokers from continuing.
One of the good things about the tobacco taxes that have been put into effect is that they affect more of the people who can't afford tobacco products. They affect more of the kids, so that the higher the taxes are, the less amount of kids start smoking. And that's been very beneficial in reducing our
So it's
tobacco
actually a good
rates.
tax.
Yeah, it's
There's
a
a good
good
tax. There's a good
tax
social
because it
purpose to it.
dissuades people from smoking to begin with.
And we're using the revenues that we get as a way of paying for further information to the people as to the
Correct.
the horrors of the health implications of smoking.
Right, right. And actually it's getting harder, I think, because you have more of the hardcore people who are hardcore addicted to tobacco that are doing the smoking now. So we certainly need more services for them to stop smoking.
That's not your only issue, though. You're up here on a couple of other things as
We're
well.
up here to talk about the Cancer Services Program, which is a program that allows for people who don't have insurance to get screened for breast cancer, colon cancer, and cervical cancer. And the second part of that is it not only allows them to get screened for it if they don't have insurance, but if they have a positive finding from their tests, there then is a treatment section of that the state does pay for treatment for people who have had positive
So again, we're
findings.
trying to either stop the development of cancers or identify them early so that they are treatable.
Correct.
And we don't end up with either deaths or significant health problems in the future. So again, it's cost effective to spend this money. Now, as I'm understanding, the executive budget is proposing another reduction.
$449,000.
So it's almost half a million dollars. And this funding was where at one time?
It was up to $29 million at one time, and now it's being proposed in this budget at $25 million. So, and it only allows for about 20% of those people who are eligible to get screenings. So it's quite needed. And even with, I know the question came up when we had a meeting earlier about people getting insurance through the access to, through the new health care law. And actually, there'll still be quite a few people who are still not insured, even with people signing up for insurance. So there still is a
This
need.
is like a safety net.
It's absolutely a safety net. You know, we had a press conference earlier, and one of the person was talking about her experience with the cancer service program. And basically, if she didn't have the insurance for this, she would never have found her cancer. She wouldn't have lived. And you know, these programs
This is all
affect
about
real people. And it's so moving when you hear the stories of people who've actually gone through the programs and didn't have access to health care in other manners.
Lastly, you're here talking about something that we might not think of associated with the American Cancer Society, but in lingo in Albany, it's called prescriber prevails.
Right.
What is that about?
Well, it's about. I'm sorry.
Which one of you?
It's-
Flip a coin.
We're gonna both do this.
It's about off-label drugs. And what is being proposed is that the Commissioner of Health or that the managed care plans can require prior authorization for any off-label drugs. An off-label drug is when a drug that is prescribed normally for one type of disease can be helpful in another. And that affects cancer patients adversely.
So it may be used in Europe to treat a cancer, but here it has not yet been approved for that
It may be
purpose.
used, I'm sorry, it may also be used here to treat
something else.
another disease.
Right.
And with cancer, a lot of times a combination of drugs are put together, and within that combination is a drug that isn't normally associated with treating
So
cancer.
a doctor may want to try to use this drug.
Exactly.
And so now some insurance company or some bureaucrat in the state is going to say, we're not going to let the doctor decide what's best for the patient. We're going to decide what's best for the patient. Because we're only going to pay for it
if there's prior
if there's
authorization.
prior authorization
Right.
from the insurance company.
And
or whatever.
even when you get prior authorization, that takes time. So therefore, there's a delay in treatment, or there's more paperwork for the doctors, and doctors are always complaining about they have much too much paperwork too. So it could lead to delay or denial, neither of which is acceptable.
Yeah, we really want to make it easier for the patients to go through their cancer experience, and certainly eliminating some of the barriers to their getting health care and treatment quickly is very important to us. So we would not like to see there be an intermediary between the doctors being able to prescribe the drugs for the patients.
I think most patients would feel that way too. They go in to see a doctor says do this, and then all of a sudden somebody from an insurance company or from the state says, we're not going to pay for that, so you can't do that. You either have to be rich, pay for it yourself, or you don't get it.
Right.
So once again, we have the system standing in the way of what's good health care.
Right.
Right.
I thank both of you for coming to Albany, explaining this to us, and pushing very hard for what's right for the people of Westchester County and for the state of New York.
We thank you for
Thank
taking
you,
the time.
and we really appreciate your time.
And I want to thank all of you for watching. Tom Abinanti, Albany Update. If we can be helpful, don't hesitate to contact my office.
know.